Are you looking to figure out who you should see for a voice problem? Let's talk about the voice care team for singers. Hi, I'm Stacy Menton from singingmamashomestead.com, and today we're going to be talking about the voice care team and who should be included in your voice care team as a singer. So number one would be an ENT. Now, there are many different flavors of ENT. There are ear specialists known as otologists who specialize just in the ear. There are rhinologists who specialize in the sinus. There are head and neck surgeons who specialize in head and neck cancer. And then there are laryngologists, or people who specialize specifically in the voice. That's who you're most interested in seeing as a singer. You want somebody who has that extra training. Specifically, you want a fellowship trained laryngologist who has extra training and probably has better equipment than your average local ENT. The second person that you want to see is a speech pathologist. There are many different kinds of speech pathologists. Some of us specialize in neurology disorders like strokes and head injuries. Some of us are more looking at the pediatric side of things from a school perspective, in helping children with developmental delays learn better language and articulation and pragmatic skills. And some of us are voice specialists. There's a lot of different things. We treat patients across the lifespan. From birth until death, we are treating patients. And we all specialize, we all start to specialize in some kind of subspecialty. Now, I'm a singing voice specialist and a voice specialist, so I predominantly see patients with voice and upper airway complaints. I have colleagues who work in the hospital, though, that see patients who have swallowing difficulties and language difficulties after strokes or pneumonia or now COVID. So you want to make sure that the speech pathologist that you're seeing does voice therapy and has done some continuing education in voice, because voice at the graduate level, you have to have a master's degree to be a speech pathologist, and voice at the graduate level is usually one course in most programs. And continuing education is key, but also having an interest in voice therapy really helps make sure that you're getting seen by somebody who knows more than one technique to treat voice. So you want to make sure you find somebody who has at least some interest in voice therapy. You can also find, in some cases, if the only problem that you have is with your singing voice, a laryngologist may refer you just to a singing voice specialist. Now, a singing voice specialist, that designation can mean a lot of things. There's no specific credentials required to become a singing voice specialist, which can be very frustrating for those of us who treat singing voice all the time. So a singing voice specialist is either a speech pathologist with interest in voice. So for instance, I have 2 master's degrees, one in voice performance and pedagogy, as well as an undergraduate in music. And then I have a second master's degree in speech language pathology, and that combination of degrees plus extra coursework that I've taken make me a singing voice specialist. The other path to becoming a singing voice specialist is to be a voice teacher who has taken additional coursework in regards to voice pathology, so they know how to work with patients with injured voices. So that is the singing voice specialist piece. And then finally, there's the voice teacher. Now, there is no credentialing for voice teachers whatsoever, and every genre has kind of a different way of judging who's a good voice teacher and who's not. And honestly, it really just comes down to personal preference. You're looking for somebody who specializes in your kind of music, whatever genre that might be. And then you're also looking for somebody who you get along with well and who gets you to some extent, so that you're not butting heads every time you're trying to learn a new song or learn a new technique. like I said, there's no credentialing for voice teachers. And then the most important member of your care team should be you. You are the most important because it's your voice that we're talking about. You know what you're feeling better than anybody else. And if you're insisting that there's a problem, then there's a problem, and somebody should be getting to the bottom of it. And so sometimes finding, getting 2 or 3 opinions isn't a bad idea. If you feel like the first opinion just seemed off the mark, that the treatment that they offered wasn't helpful, or that you just don't feel like you clicked well with the surgeon who may someday have to do surgery on your vocal folds. So to recap, you want to make sure that you find a laryngologist, which is an ENT that specializes in treating the voice. You want to find that laryngologist early in your career so that they can do a scope and have a baseline scope of what your voice looks like when it's normal. So that when you have an issue, we're not contributing your issue to something that's been there this whole time, and you're not getting surgery for something that you don't need surgery for. The next member of your team that you want to make sure that you're considering is a speech pathologist who specializes in voice. And that speech pathologist may also be a singing voice specialist, or your laryngologist may refer you to a singing voice specialist who's a voice teacher, just depending on what your specific needs are and who the laryngologist is familiar with and comfortable sending you to. And then finally, your voice teacher is another member of your voice care team. They're usually the first ones to notice when something goes wrong, except for the most important person in your voice care team, who's you. If you are starting to notice something wrong, you want to talk to your voice teacher. They might be able to refer you to the local laryngologist, whoever's closest to you. And then you can see the speech pathologist that the laryngologist refers you to. At the end of the day, if you're interested, there is also a course on my website, singingmamashomestead.com, where I teach you about vocal wellness. And I'll leave a link in the description below if you're interested in taking that course. All right, thanks for coming to see me today, everybody, and I'll look forward to talking to you soon.